Infection with HIV is no longer a deadly disease thanks to the antiretroviral medicines, or ARVs. When they take their ARVs correctly, people living with HIV can lead a normal life and have a life expectancy similar to those who are not infected. ARVs are saving the lives of millions of people living with HIV. HIV drug resistance can result in the death of many patients and the transmission of resistant infection to others. Like all viruses, as they replicate, HIV transforms or mutates all the time and may become resistant to the available ARVs. This mutation is encouraged when treatment regimens are suboptimal or when the patients have poor adherence. There are many reasons why patients adhere poorly or drop out from their treatment. Personal reasons such as difficult life conditions, major events in their lives, intolerance of the medicines, or experiencing stigma and discrimination are some of those reasons. When the service quality is poor, procedures for acquisition of the service are complex, service staff exhibit negative attitudes, or when the cost of the service is high, patient may drop out from treatment. HIV treatment services should closely monitor their patient adherence and alleviate the factors that lead to poor adherence and compliance, and put in place measures that encourage their continued engagement and adherence. National HIV programs should periodically monitor drug resistance and always ensure continuous, uninterrupted supply of ARVs in all treatment sites. To lower the risk of drug resistance, they should always optimize the treatment regimens and simplify care pathways to increase accessibility of services for people living with HIV. Everyone can have a role in preventing HIV drug resistance. Public health planners, HIV programs, people living with HIV, and service providers. Actually, the whole society can contribute to preventing HIV drug resistance by reducing stigma and discrimination against people living with HIV and people at risk of infection. United to preserve antimicrobials.